Breast cancer is one of the most common cancers globally, impacting millions of lives each year. For those diagnosed, understanding treatment options can be empowering and helpful. While there are several types of treatment, medications play a key role in managing breast cancer for many patients. Let's take a closer look at the medications approved for breast cancer, the different types available, and how they work. When it comes to treating breast cancer, there isn't a one-size-fits-all approach. Depending on the type and stage of cancer, doctors might suggest a mix of treatments, including surgery, radiation, and medications. Medications can be particularly important, either as the main treatment or to support other therapies. Some drugs work by directly targeting cancer cells, while others help to regulate hormones that influence cancer growth. For many people, understanding the role medications play can make treatment feel more manageable. Let's break down the main categories of breast cancer drugs to see what they do and how they're used. Types of breast cancer medications. Medications for breast cancer fall into a few main categories: chemotherapy, hormone therapy, targeted therapy, or immunotherapy. Each of these categories works differently, and your doctor's choice will depend on the specifics of your breast cancer. Number 1. Chemotherapy drugs. Chemotherapy is probably one of the most recognized cancer treatments. But how does it actually work? Chemotherapy drugs are designed to kill cancer cells, either stopping them from dividing or slowing their growth. These drugs circulate in the bloodstream, making them effective at targeting cancer cells that have spread beyond the breast. Common chemotherapy drugs for breast cancer include doxorubicin. Often called the red devil for its striking red color, doxorubicin is powerful and effective, but it can also have strong side effects like hair loss and fatigue. It's used in combination with other drugs to maximize its effectiveness. Paclitaxel. This drug interferes with the way cancer cells divide, which helps to stop them from spreading. It's commonly given over a few months in cycles, which means periods of treatment followed by periods of rest to help the body recover. Chemo drugs are powerful but comes with side effects like nausea, fatigue, and hair loss. These effects can be tough to manage, but your medical team can often help with medications to ease these symptoms. Number 2. Hormone therapy drugs. Hormone therapy is a bit different. It's specifically for breast cancers that are sensitive to hormones, known as hormone receptor-positive cancers. Some breast cancers grow in response to estrogen or progesterone, so blocking these hormones can slow or even stop cancer growth. Here are some key hormone therapy drugs. Tamoxifen. This drug blocks estrogen from binding to cancer cells. It's usually given to premenopausal women or those who've had surgery to remove a tumor. Tamoxifen can be taken for several years and has been shown to significantly reduce the risk of cancer recurrence. Aromatase inhibitors. These are typically for postmenopausal women. Aromatase inhibitors stop the body from making estrogen, which can be especially effective for hormone-sensitive cancers. They're often taken after surgery or chemotherapy to keep cancer from returning. Hormone therapy drugs have their own set of side effects, including hot flashes, joint pain, and a potential impact on bone density. Some people experience these more strongly than others, so if it's difficult to manage, let your doctor know. Number 3. Targeted therapy drugs. Targeted therapy drugs represent a big leap forward in treating breast cancer. Instead of affecting all cells, as chemotherapy does, targeted drugs home in on specific molecules involved in cancer growth. This means they're generally more effective against cancer cells and less harsh on healthy cells. Some important targeted therapy drugs include trastuzumab. This is a game changer for patients with HER2-positive breast cancer, a type that's more aggressive. Herceptin attaches to the HER2 protein on cancer cells, slowing or stopping their growth. It's often combined with chemotherapy to enhance its effectiveness. Pertuzumab. This drug works alongside Herceptin to further block the HER2 protein, making it harder for cancer cells to grow and divide. It's typically given for advanced or metastatic breast cancer, where the cancer has spread to other parts of the body. Targeted therapies usually come with fewer side effects than chemo, but they can still cause fatigue, nausea, and heart issues in some cases. However, they offer a more personalized treatment approach, focusing specifically on the cancer's unique characteristics. Immunotherapy for breast cancer. Immunotherapy is a relatively new approach in breast cancer treatment. Unlike traditional cancer drugs, immunotherapy works by encouraging your immune system to target and destroy cancer cells. For certain types of breast cancer, immunotherapy can be a very effective option. One example is pembrolizumab. This drug is an immune checkpoint inhibitor, meaning it releases the brakes on the immune system, allowing it to recognize and attack cancer cells. It's mainly used for triple-negative breast cancer or TNBC, an aggressive type of cancer that doesn't respond to hormone therapy or HER2-targeted drugs. Immunotherapy is exciting because it can provide a long-lasting response for some patients. However, it doesn't work for everyone, and it can have immune-related side effects like skin rash, fatigue, and diarrhea. As for new and emerging treatments, the world of breast cancer treatment is always evolving, and new drugs are continuously being tested and approved. In recent years, medications like PARP inhibitors have become available for people with specific genetic mutations, like BRCA. These drugs, such as olaparib, work by interfering with cancer cells' DNA repair process, leading to cell death in tumors that rely on this pathway. Other new drugs include CDK4/6 inhibitors like palbociclib, which block proteins that help cancer cells grow. These are usually combined with hormone therapy for people with advanced hormone receptor positive breast cancer. If you or someone you know is newly diagnosed, ask about recent advances. There may be a promising new option available. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Some of the considerations and side effects you should consider. With all breast cancer treatments, side effects are a reality. Chemo might cause nausea and hair loss. Hormone therapy can lead to hot flashes and joint pain. And targeted therapies can sometimes affect the heart. The type and intensity of side effects vary widely, so it's important to talk to your doctor about what to expect and how to manage them. Many side effects can be reduced with medications or lifestyle advancements, making the treatment journey a bit easier. Breast cancer treatments has come a long way, and the availability of different medications has given people more options and better outcomes. Whether it's chemotherapy, hormone therapy, targeted therapy, or immunotherapy, each drug serves a purpose in the fight against breast cancer. As research continues, new treatments will hopefully make breast cancer even more manageable and beatable for those affected. If you or a loved one is facing breast cancer, remember that you're not alone. A strong support system coupled with informed decisions about treatment options can make a big difference. Always consult your medical team about your options and don't hesitate to reach out to support groups or cancer organizations that can provide further information and assistance. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.